I'm Jim Dodson. I'm a personal injury lawyer. My office is in Clearwater, but we represent clients throughout Florida. You know, in dealing with the treatment and diagnosis of brain injuries, typically people are going to run into a class of physicians that are fairly unique to this area of medicine. Kind of the frontline doctor that people will run into initially when they've been involved in an accident or an injury is a neurologist. Neurologist is someone who's trained in understanding the operation of the brain, the spinal cord, and the nervous system, but they generally are called upon initially to look at the symptoms that someone has and start categorizing that as a brain injury. A neuropsychologist is a branch of psychology, actually, someone who's had special training, and they typically are testing someone with a battery of tests for behavior and cognition, how we think and how we act, and how that's been affected by a brain injury. They will also typically design some type or make a recommendation for a treatment plan for someone who has been diagnosed with a brain injury. We have neuroradiology. That's a doctor who is in the branch of radiology who is going to interpret, the PET scan, the MRI, the CT scan, the X-rays that are showing typically a loss of function or the operation of the brain from an imaging study. And then we have neurosurgeons. Neurosurgeons are only involved in brain injuries typically where there is an actual bleed within the brain that requires either what they call an operation to remove or reduce or eliminate that blood clot. So it's involving an injury with surgery. So those are the primary doctors that people will run into when they've had a brain injury, all with a very unique function.